Good day, I'm Angeli Macy Xylon. Today, I'm going to demonstrate about starting an intravenous infusion, regulating intravenous fluids, and discontinuing intravenous infusion. So, let's start!
First is to check the doctor's order and make an IV label. Wash hands. This prevents the spread of microorganisms. Gather all equipment and prepare the IV solution and tubing. Having all equipment available saves time. Maintain aseptic technique when opening sterile package and IV solution. Clamp tubing. Uncap the spike and insert it into the entry site on the bag or bottle as the manufacturer directs. And if an additive is ordered, incorporate it before inserting the spike into the entry site. Suspend the IV solution on a hook in the preparation area and press the drip chamber and allow it to fill at least halfway. Remove the cup at the end of the tubing. Release the clamp and allow the fluid to move through the tubing. Allow fluid to flow until all air bubbles have disappeared. Close the clamp and recap the end of the tubing, maintaining sterility of the setup. Notify the physician or nurse who will insert the IV. When he/she arrives, bring preparation to the bedside.
Good day, ma'am. I'm Angeli Macy Xylon. So, I'm your student nurse for today. May I know your name, ma'am?
I'm Angela Pica Queen.
Okay. Ma'am Angela, may I see your ID band? Thank you. Okay. Ma'am, may I know when is your birthday?
November 26, 2000.
November 26, 2000. Okay, great. So, ma'am, I am here today to start an IV infusion. So, the purpose of this is to maintain or replace the body stores of water, electrolytes, vitamins. Is that okay?
Yes.
And before that, ma'am, so I will need your hand to put an IV cannula. So, it will take a couple of minutes. Is that okay?
It's okay, it's fine.
Thank you, ma'am.
Have the client in a supine or low faller's position in bed. Suspend the bag or bottle of solution on the IV stand. Hand the tourniquet to the doctor or nurse followed by a cotton ball with alcohol and the needle or vasocan. Observe while the doctor or nurse is inserting. Anticipating the needs of the doctor is one of the good characteristics of a nurse. Release the tourniquet when he/she indicates or when a return flow of blood to the adapter is observed. Connect the tubing to the needle. Start the flow of solution promptly by releasing the clamp on the tubing. Examine the site for signs of infiltration.
Support the needle with a small piece of gauze or tissue paper under the hub, if necessary, to keep the needle in place. Then, loop the tubing near the site of the entry. arm board for support if necessary.
Adjust the rate of flow according to the doctor's order. Complete the label and tape to the IVF bag or bottle. Do the aftercare of the equipment and wash hands to deter the spread of microorganisms. Document the procedure and the client's response. Chart the time, site, device used, solution and rate of flow, and the physician's or nurse who inserted the needle. Monitor periodically at least every 30 minutes to check flow rate and observe for infiltration and other untoward symptoms. This documents the client's response to the infusion. Check the written medical order. Identifies the drip factor on the IV tubing package and calculates correctly the rate of drops per minute. Next is to check the patency of the IV line and needle. Counts the number of drops flowing into the drip chamber for 1 full minute. Tightens or releases the ruler clamp until the calculated rate is infusing. Then, monitors the IV flow rate at frequent intervals. Documents the type of infusion, amount, flow rate, and client's response to the prescribed infusion rate. Check the physician's order for discontinuing IVF. Wash hands and assemble the equipment.
Good day, ma'am. I'm Angeli Macy Zylon. So, I'm your student nurse for today. May I know your name, ma'am? Okay, great. So, ma'am, may I see your ID band? Okay, thank you. Okay, thank you. So, ma'am, may I know when is your birthday? Okay. So, ma'am, I am here today to discontinue your IV infusion because the medication administered by the IV route are no longer required or are no longer needs. So, that's why the doctor ordered to discontinue your IV infusion. So, is that okay? Okay, great. So, let's start.
Release anchorage of arm, tubing, and needle. Loosen the tape at the venipuncture site while holding the needle firmly and applying countertraction to the skin. Don gloves and clamp the infusion tubing. Hold the swab above the venipuncture site. Withdraw the needle quickly by pulling it out along the line of the vein. Immediately apply firm pressure to the site using the swab for 2 to 3 minutes. Then, hold the client's arm or leg above the body if any bleeding persists. Check the needle or catheter to make sure it is intact. Then apply a dry cotton ball or band-aid to cover IV site. Discard used supplies appropriately, remove gloves, and wash hands. Record the amount of fluid infused on I&O record sheet and on the chart if necessary. Include the type of solution used, time, and reason for discontinuing the infusion, and the client's response.